Good morning and welcome to an all-new episode of Hatching for Health. Today we are welcoming back to the show Dr. Dung Pham, also known as the Penis King. Welcome to the show. How are you?
Hi Jessica, how are you?
You look
Thanks
sharp.
for having me back. Thank you.
Absolutely, with a bow tie. And I wouldn't expect anything less. Let's put it that way.
Once in a while, I have to dress up.
Yeah, a nice little combination there.
How's it been?
Good.
How you been doing? Good.
It's been good. Yeah, we had great ratings as it related to your episode and just kind of sharing what you're doing for the public. I mean, here in Houston, but also patients that you have flying from out of state. I don't know if you had any out of the country, but you've had, quite an impact on a lot of people, and it shows,
Yeah, we're doing a map. Basically, I think I'm going to retire after half of it, but we've had patients from France, England, Dubai, Angola,
Wow,
Kenya, Venezuela, Mexico a lot.
that is incredible.
Yeah. And
So your reach, I mean, is a lot
China, a lot from China, Vietnam. And so I don't know how they found me. I'm just a plumber.
It's quite, it's quite incredible. I mean, you're basically Crescent Urology Institute is your practice. And so, within it, you have other associates and you guys do urology, but you've kind of just created this niche of obviously helping, men predominantly with, penile issues. And I think that that's something that is very hard to find. So when people do find you, it's like, how do I get to them, And I know today's really exciting because in the second half, we're actually going to have one of your patients, Hector, come on and kind of have like his own testimonial because we didn't have that last time.
Right.
And that'll be, really appreciative, right? Because I mean, this is a very personal situation between you and a patient, and for someone to actually be brave enough to speak about it, it's really just a blessing that they're going to help somebody else, basically.
Right, and I think that was his intention was, basically, I won't go too much. I'll let him tell his story, but it pretty much ruined his childhood just for a condition that was easily fixable. Unfortunately, it's just such a sensitive topic that even to this day, nobody wants to talk about it. And so, I'm just fortunate to be gifted and humbled to be able to help these type of patients.
Of course. So tell me a little bit, for those that didn't, actually get to learn about you and kind of where you started in your practice, tell us a little bit about where you started and with medical school.
Yeah, so I went to UT Houston Medical School, and then I did a year of research, and then after that I did my fellowship at Texas Children. And then in 2013, basically, if you wanted pediatric urology care, you have to go to Texas Children.
Okay.
And so at that time, Memorial Hermann and University of Texas Houston Medical School pretty much had every single subspecialty, but they didn't have pediatric urology. And so I'm a big believer in, I hate to use the word competition, but really it shouldn't be competition. But if you're a monopoly, the surgeon will never be better.
Yeah.
And so then it's a tough decision because, all my friends, mentors.
Of course.
That's where I met my wife, And so, but I took it on. And then so from 2013 to 2016, I built the pediatric urology program that's currently now at Memorial Hermann in UT Houston. And when I handed it over, surprisingly, it's 3 surgeons that are all Texas Children trained.
Really?
So, yeah. And so really around the city, we're all really Texas Children trained with a few exceptions. There's new blood that's coming in, but there's only about 10 of us around the city, and out of the 10, I don't, I do about 800 cases a year, and so I predominantly just kind of focus on penis.
Okay.
And so in 2019, I didn't want to be a revolving door practice, and so what I did was, the old saying, jack of all trade, master of none, and so there's a lot of people that want to work for Crescent, but I'm very picky. It has to be somebody who has to have a specific interest in a specific field.
Okay.
Yeah, that's the only way that you can be good.
And you have currently, is it 2 associates or?
Yeah, currently I have 2 partners.
Okay, or 2 partners.
And then we're negotiating with 2 more guys. Let's see how the compensation goes.
Yeah, right.
It all boils down to the compensation package. But no, we have a couple of guys that kind of want to go under the Crescent Urology umbrella. So,
Okay. And your location is medical center, like right here in the heart of Houston?
yeah, so we have multiple locations. So we have one that's just next to the Children's Museum. We have one in Pearland, one in Sugar Land, and one in Memorial City. And then
Okay.
our flagship clinic will be the one on Richmond, kind of near the Tanglewood area.
Oh,
And
great.
so that'll be the first comprehensive men's health clinic in the state of Texas, actually.
That's what you were telling me about. That's going to
Yeah.
be an incredible like option for the men of Houston. And that's something that your guys are doing, obviously, regular treatments, but then surgical procedures could be available to them. But it's mainly about kind of the overall men's health.
Yeah, so like basically, a lot of people are confused about men's health. They think men's health is like a testosterone clinic.
Yeah.
When most of these testosterone clinics are really ran by like primary care doctors. Men's health really is exactly what you said, comprehensive, meaning that, it has to do with heart disease, nephrology. But the problem with men is that, they get a little, like we all know, number one killer of men's heart disease. But if they get a little chest pain, they'll just be like, oh, I just worked out a little bit too hard. And next thing you know, a week later, they drop dead.
Yeah.
But yeah, it is very unfortunate. But when they have a little lesion on the penis, it's, oh my God, there's a medical emergency. I need to get in right now.
Yeah.
So in business, we have something called the tripwire effect. And basically, what men will do is we will bring them in, meaning that, because of issues with, their personal, or what I call their brain. That's why outside of work, people go, Dr. Fan, what do you do? I go, I'm a brain surgeon for men. But the tripwire effect is basically once they get in, then we actually have a PCP that will counsel them and tell them how, kidney problems, heart problem, pulmonary, psychiatry, whatever it may be, all ties into this. This is just a symptom, but you're not treating the source.
I see.
And so comprehensive men's health clinic requires that you have to have cardiology on board, nephrology on board, pulmonary on board.
So like multidisciplinary
correct.
practice will be made up within this group,
Correct.
Essentially, or the group will be just that.
Well, the group will be under, it's complicated, but the group will actually be under Crescent Health Network.
Okay.
Yeah, but that's why it's tough to put together. It's not like women's health where, it's easy to put together because, women, they go to the doctor. For men, they're just not going to keep going to the doctor.
Yeah, that's like men will do a physical, which in addition a woman does, but the woman has that separate yearly appointment to the gynecologist to kind of, get everything checked out. And I guess men don't really do that.
They don't.
Yeah.
but if you let them know basically all of this erectile dysfunction or whatever it may be ties into the heart, the kidney, the liver, whatever it may be, then they will be more prone to, okay, if you can set everything up for me, doctor, then I'll come back a second time. And so that's the plan, is then the primary care doctor will tell the patient, okay, you're going to need to see, let's just say cardiology, nephrology, pulmonology. That's your problem. So then they'll just come back a second time. We'll get authorization for all that. Imaging center and everything is there. Pharmacy is there. Pathology is there. All in one place. And then, and then they would come back for a second appointment, get everything checked out, get whatever treated. As long as men doesn't have to go more than 2 or 3 times a year, they're happy.
They'll make it happen. Yeah.
Right, especially if they see the results right away, which is you get this up, they'll keep coming back.
Yeah, exactly. The master plan. So with a lot of these patients, so basically in your, I guess, kind of training, a lot of it was with children, Texas Children's, obviously. So how does it that you, I guess, have developed a practice where, you see both? Because I feel like a lot of times you're either focused solely on pediatric or adult, but you kind of have a nice combination. And is that just kind of the way that you've, made your practice happen? Or it's not very common, though?
It isn't. Mostly, pediatric urologists tend to focus on age below 18. During residency, I spent a lot of time at MD Anderson. And so we actually did a lot of reconstruction of, you name it, and then what ended up happening was really children's surgery is really no different than adult surgery.
Okay.
The concept is the same. It's just more of, you know, pediatric urologists tend to want to stick to below 18, and adult urologists tend to want to stick above 18. But legally, you just need an adult urologist can treat a 3-month-old if he wanted to.
Okay.
Yeah, but from a liability reason, they don't want to.
I see.
Just because pediatric urology is a boarded field. Yeah, and so for me, I just enjoy helping, you know, men.
Yeah, when the opportunity to help somebody presents itself,
Right.
you're almost kind of blinded by where they at in life, you know.
Right. The age doesn't matter.
Yeah.
Yeah, and so I always joke because my youngest patient I operate on is a week old, and the oldest patient I ever operated on is 67 weeks old. So that just tells you, you know, or I guess I can be called maybe Dr. Cradle to the Grave sounds better than Penis King.
Well, we do have to take a commercial break, but I'm excited to do so because when we come back, we will be joined by Hector, who has experienced from a young age, you know, things that you were able to help cure in his older years. So we will take a quick break, and we will be right back with you. Hey, welcome to Infinity Diagnostic Center and Prestige Medical Pain Clinic. We are right here in the heart of Houston, inside the 610 Loop. We do interventional pain management and we do MRIs. Our MRI facility offers a 1.5 Tesla Siemens magnet. We can do MRIs of the brain, spine, any extremity, foot and ankle, we got you covered. Then we have our pain suite. So our pain suite is for when you do have that pain. You get the MRI and now the doctor can sit and evaluate that MRI with you and look at exactly what's going on. And right here, they'll do an interventional pain injection, ESIs, transforaminal, a various amount. We've got 2 doctors on staff, so we got you covered. Before you actually get set up over here, you're gonna come to our consultation room in which you will be visited with one of the specialists. And we're treating insurance, cash patients, Department of Labor, and personal injury, which is so important. So we can take care of all of those different needs. Just come see us here at Infinity Diagnostics and Prestige Medical Pain Clinic. Welcome back from the break. If you have just joined us, we are here with Dr. Dung Pham, and we are talking about penises. We are going to have a guest join us now. It's actually one of his patients, Mr. Hector. So go ahead and come on the show. How are you?
Hey Hector, how are you?
There
Have
you
a
go.
seat.
Nice to meet you.
Nice to meet you.
Yeah. Thank you for coming out.
Oh, no problem.
And you're local here. You're here in Houston?
Yes.
Okay. Were you born and raised?
I was born here in Houston. When I was 2 years old, they took me to Guadalajara, Mexico.
Okay.
So I was in Mexico for 8 years, and then when I was 11, we came back to Houston.
Okay.
And then ever since then, I've been here in Houston.
So pretty much home now. Yeah, I mean,
Yes.
always
Yes.
the adult life of it anyway. Well, wonderful. So Dr. Pham was a friend of ours that I've actually met a few different times and gotten to know him and learn about his practice. And I know that I talked to him about different patients coming on and just really having an opportunity to have that testimonial from what he's been able to do in people's life to help change it. So if you can kind of just take us back a little bit to, you know, when you learned, hey, I want to go see a doctor, you know, so the viewers can kind of understand your story.
So I know Dr. Pham for a while through the social media and through our cars and stuff. We hang out and
Go figure.
we got same kind of taste in the cars. So I started seeing a lot of his Facebook page and, you know, talking about penis and all those different
Kind of surgeries
kind
and
of
stories.
surgeries and stuff that he did. And that kind of made me reach out to him
Okay.
and say, you know, I've been having this problem and I wanted to get somebody's opinion.
Of course.
And I felt really comfortable with him.
And what age was this? Was this?
This actually happened right towards the end of the year.
Yeah.
But yeah, it just
Okay.
happened.
So this is a recent.
Yeah,
Okay.
the surgery was December 22nd.
Okay.
But I've been having this problem. I thought I was born with this problem.
I see.
So I never thought about reaching out to anybody until I actually saw some of the articles that he would put and some of the surgeries that he would put on his social media that actually made me realize, okay, there might be something that is fixable.
Yeah.
Maybe I wasn't born with it, or I was, but I can get it fixed.
What was that? I mean, what was that moment like for you? Because, like, I think even for a man or woman's, if they're thinking all their life that, like, I was born with this, is just the way things are, and then something kind of is like an aha moment, and a very special,
It was very kind of exciting reading through his web page. That it actually was. I had an actual what do you call it?
kind of like a diagnosis that's
Yeah,
fixable.
exactly. So going back to when I was little, growing up, I wanted to play sports, but I was always afraid of, you know, taking a shower after you play football or soccer or
Uh
baseball,
huh.
whatever the sport it was. So it kept me from doing a lot of stuff through my young age to now,
Okay.
because uh, I was always in my head, I was afraid of, you know, who would see it or who will
Mhm.
bully me or who will take some kind of, uh, I guess you can say bully.
Yeah.
So I was scared of that, so I was never was able to reach out to anybody. Second part of the problem was that, we're lucky enough to have health insurance for the last 20 something years.
Mhm.
But I do my physical every year,
Yeah.
and none of my doctors ever said, hey, you know, you
Mhm.
should go get this checked out.
Okay.
Until today,
Yeah.
nobody has. They always said, okay, 'cause I was overweight and I did
Mhm.
a gastric bypass. Uh, so that doctors told me you need to lose weight. But
Yeah.
on this problem, nobody ever said anything.
Addressed it. It was just kind of.
It was kind of there. I went to do my physical every year, and like I said, growing up, nobody said, "Hey, that doesn't look right or
Uh
it's a
huh.
problem."
And so, Dr. Pham, just to kind of touch in, so basically the diagnosis that he's given, I mean, you probably know what it is as well, but can you tell me kind of at that point what that is determined to be
Yeah,
called, I
so
guess?
yeah, so Hector's story, about the weight loss, I just want to kind of clear this up. There seemed to be this miscommunication or misconception that if you're chunky, then that's what makes your penis look short.
Mm-hmm.
And so that's exactly what Hector was talking about. He thought that was the problem, so he went and got gastric bypass, lost weight, and he still couldn't
Okay.
see his penis. So basically, Hector was diagnosed with buried penis or hidden penis,
Okay.
where basically it was just sunken down like a turtle head.
I see.
And and I mean, it's hard to blame the doctors because it is a very specialized field, and
Mm-hmm.
but this gets missed a lot because they always think it's weight,
Yeah,
and then
if there's a weight,
right.
situation, then they might lean towards that
Correct. But
versus.
but the reality is, if you believe the numbers, if you're chunky or a little bit chubby, then it makes your penis look 30% shorter.
Mm-hmm.
If you have a six pack, it just makes your penis look 30% longer.
Mm-hmm.
But the way to look at it is this: anything that insurance won't cover means that there's probably no health benefit to it, and
Mm-hmm.
insurance will never cover fat reduction. However,
Mm-hmm.
they will cover hidden penis, which is
Okay.
basically, and to correct it, is basically penis elongation, is
Okay.
what it is.
Okay. And so, going back to your story, so just so people can kind of, understand the situation. So, you're growing up and like you said, I mean, sports, different things that, you want to be involved in
Yeah.
and, you want to partake in, and you're actually, limiting yourself
Hmm.
because of a complex that you didn't even know was curable.
Yeah.
Um, so it's just amazing how social media is there at our fingertips these days that we find things, and a show like this is also a reason to just put it out there in front of the public, because for those that aren't on social media, but maybe they're
Yeah.
watching CW39 at home.
Hmm.
Um, so take us back. So at this point, throughout your life, you're kind of going through, essentially what you feel is bullying or just kind of hiding behind what's going on. Um, and then you find this opportunity to go basically see Dr.
Hmm.
Pham. Okay.
So that's when like I said, throughout my life, even going to public events, concerts and stuff, the way the bathrooms are. So that was always in my head.
Mm-hmm.
I didn't have problems with erections and stuff like that, but it was just the hidden penis. So at that point, I started seeing some of the Facebook, his social media, and that's when I realized, okay, let me go talk to him and see if this is actually something that is fixable. And I was actually even embarrassed when I made the appointment. They asked me what what the appointment was for, and I'm like, I just want to talk to Dr. Pham.
Yeah.
I talked to him one-on-one and let him know, because again, it's a very touchy subject, and for me and for most of the men.
And that brings up a good point. And I just would like to know, when you guys do get that phone call, obviously you're not answering the phone, but when your team is answering the phone, and they can sense hesitation from a patient wanting to make an appointment, do they push them for like more information, or they just say, okay, great? Like, because I know that that's something you have to plan for the time spent with the client or patient coming in. So I get the reasoning behind needing more details, because even as a woman, it's like, I mean, you get an infection, it's like, what kind of infection? It's like, you know what I mean? You just sometimes are like, you're a little more hesitant to like share with a stranger over the phone. But how do y'all handle that? Are y'all able just to kind of?
Yeah, so typically we train our staff to basically, make the patient feel comfortable. So we really don't push too much. What we just put is personal issues,
Okay.
and want to talk to Dr. Pham.
Gotcha.
And that kind of pretty much let me know that it's something intimate.
Okay.
Yeah.
And that's how it was.
So it was able to, yeah.
Yes, they asked me, and I was like, I just want to, have a consultation and talk to him directly.
Yeah.
And so they made that appointment, and, like I said, we known each other, which it was still, again, a little bit embarrassed for me because we know each other.
Yeah.
But at the end, he saw that it was an actual issue that I had, and it was fixable. And he was grateful enough to do the surgery before the end of the year, because he was going to go, like I said, December 22nd. So he took care of my surgery, and through the whole process, he kept my wife informed and everybody, and recovery, it made us closer, and it made me realize that even my wife asked me, and she was like, "Are you going to go on TV and talk about this?" I'm like, well, I went through it my entire life.
Yeah.
Kind of feeling embarrassed, kind of not doing stuff that I can. So I wanted to come on the show, and Dr. Pham invited me to tell everybody out there, from parents to kids to young adults to adults, that come out and there could be a fix.
Yeah.
And the fix is sitting right here. He can guide them, or he can do the surgery. He can explain the problem. Like I said, for me, my entire life, I thought I was born with it.
Yeah.
And there was no cure. So like I said, it prevented me from playing sports. I was embarrassed, whenever you go to a concert, you try to hold to go to the bathroom.
Yeah, when no one's in there, and
they say nobody's supposed to look, but in my head, your head plays games with you.
Yeah.
So if this can help, get the word out there from my side, I would love for parents to, if they know their kids have a problem, or they see that their kids have a problem, to come out and look for help. There's solutions out there, young adults, that are going through what I went through, and they might think that there's not a cure or a fix for it. There probably is.
There probably is.
And for adults as well. It's just, like I said.
Yeah, if you're already, of the age that you've kind of gone through what you've gone through, like there's an option, you can't change the past, but, definitely being able to know that you can go and have it fixed.
Yes.
And as it relates to like a child, I guess I'll take that back to Dr. Pham. Like at what age, because obviously, certain little boys would not know, but at what age would a parent say, okay, this might be hidden penis, like I should probably make an appointment?
So the issue is parents don't know, and so they just think exactly like Hector was. They just think that, oh, my son was just born like that. And then they rely on the pediatrician to diagnose it. And a lot of pediatricians, can't diagnose it. They just like, oh, you'll grow into it, which I don't even know what that means. Like,
Yeah.
And so, and then so basically, unfortunately, it's a lot of my patients, I think we did an analysis, about 70% of my patients, they just, at age 9, 8, whatever, they're like, you know, they keep telling me to watch, but this thing is just not growing. I don't care. And it's because of social media or shows like this where they're like, wait.
So I think it would be important to maybe get some photos provided from you that are an example of what hidden penis looks like of maybe like a certain age, so that we could potentially put those as part of the episode, you know, because I mean, like you said, they don't know, and they don't want to assume that what is right or wrong, you know, but I think it would be good to kind of maybe have some type of visual to kind of go, okay, this is hidden penis first, you know, just born with like a smaller penis, you know, because I think it can be a little confusing, right?
Well, I think the issue is that everyone knows what a penis is supposed to look like, but I think they depend on their healthcare provider to tell them if this is an issue or not. And if the healthcare provider doesn't know, I mean, you only know what you know, right?
Yeah.
And so the parents that come to see me first would be either pediatricians who have seen my lectures or have had patients, older patients that they referred over, and then they got educated on, oh, so this little the penis is, if it's triangular, you know, there's certain landmarks. So then it just depends, you know, and then there are parents that are like, you know what, like, something's not right, so they'll just Google small penis. And then from there, it'll pop up hidden penis, buried penis, micro penis, which is very different now. Yeah, and then what they do is they look at the pictures and they're like, wait a minute, my son looks exactly like this. Then they'll Google, and then they, you know, that's how they find, you know, find help.
We are going to have to wrap up, which I feel like, you know, even from a viewer's perspective, it's like I have more questions, but I think photos will be helpful. I just want to say like how appreciative I am for you to come on.
No
It's more about other people. It's predominantly the show is based on helping others and children, even most importantly, because it's, you know, we can help them younger in life to, you know, to be able to have a different path. So, you know, God bless you, and it was very nice to meet you as well.
Thank you for having me.
And thank you, Dr. Pham.
Absolutely.
And we'll be back with another episode and continue to learn, you know, from your patients and their experiences.
I think in our next episode it will be how little children present with, so that'll be really neat. And last but not least, if we have a few seconds, Hector, you know, what really astonished me was when I saw Hector back post-operatively. Hector literally said this is the first time in his whole life where he actually felt the penis touch the underwear. I was, it was so tough. Like I don't cry. I almost had a tear, and I was
but
like,
I think
wow.
Everything about from physical to, I'm sure, you know, sexually with your wife. I bet, like everything, it's like a whole new chapter.
It's a whole new chapter in my life.
Yeah.
I'm 45 years old, and life changed. It's a life-changing event.
Yeah.
You know, because it's a relief. It's a, you know, something that kind of went away. The confidence on I'm good now.
Yeah.
You know that. So, want to thank Dr. Pham for helping me out, and like I said, there's so many people out there, guys, that might not know that it's fixable, but it is fixable.
Yeah.
So for me, it was a life-changing event after the surgery.
Absolutely. Awesome. Well, thank you both. I appreciate your time today.
Thank you, Jessica.
And thank you all for tuning in to another episode of Hatching for Health. We will be right back here with you next Saturday.